Can I have a non-surgical procedure to get rid of my hollowness and dark skin pigment under my eyes? I am a 22-year-old, soon to be 23, and I happen to have fairly thin and transparent skin under my eyes. Are there any remedies for me, like non-surgically or invasive procedures? I'm also starting to get some wrinkles under my eye as well. So what's your advice for me?
Thank you for your question. You're in your early 20s and you're concerned about darkness and hollowness under the eyes. So I'll share with you our approach, and I understand you're looking for a non-surgical procedure. I'm a cosmetic oculofacial plastic surgeon. I'm first trained in eye surgery before I trained in the specialty training of eyelid surgery called oculoplastic or oculofacial plastic surgery. So your concern is something that we've been dealing with for a long time. Now, I've been in practice for over 20 years, and what the good news is that we have more options today than we did when I first went into practice. First of all, when you think about it, when you're this young, unless you're smoking or doing something that is really stressful to your body, the chances are that this appearance is a genetic appearance, that the dark circles may be an ethnic appearance and the relative volume absence is more of a genetic appearance. Now, in our practice, we employ, regardless of whether it's genetic or whether it's something that becomes acquired as part of facial aging, we have to essentially define the two things that we're trying to deal with. Number one is the transparency of the skin and how you can see the darkness, maybe as the underlying muscle or the underlying bone. Two is the volume deficit. So, to address transparency, we use something called platelet-rich plasma. Platelet-rich plasma is derived from your own blood, and what it is a concentration of the growth factors and healing factors necessary for wound healing. We have found that by injecting platelet-rich plasma under this very thin eyelid skin, and the skin is only 0.5 millimeter in thickness, we're able to improve the quality of the skin and see an improvement in some of that darkness. The other option that we also offer is the use of a hyaluronic acid filler, such as Restylane. What we're doing is, by placing the hyaluronic acid filler in a very precise way in the space that needs it, we're able to restore volume and soften some of the shadowing that occurs with this situation. The limitations of these procedures is that they do need to be continuously performed on a regular basis. In other words, this is something that you can try, but it is something that you may need to do again every 6 months or so. There are people who are more severe and there are people who are less severe. And I always say that the benefit of these things, so particularly the PRP, is similar to or comparable to the benefits of weightlifting. Two people go to the gym, they both lift the same weight, they both get different results. So with the results with the PRP, and this combination, we look to see how you respond and then come up with a plan. Now, that might be too burdensome for you, and it might be better to just simply wait and just cover up with makeup. It is tough. It's one thing when someone comes in their mid-30s and 40s for this, and then it's a different thing when a younger person comes. But I'll tell you that there are a lot of very young people who are extremely motivated, learn about this option, and do come to us on a regular basis. So it's a certain degree of motivation combined with the budget available to invest in these treatments. I would also mention to you that there is a unique synergy in the combination of PRP and hyaluronic acid, and that there is some permanence in terms of what's called fibrovascular tissue, the tissue that comes in as a mimic, essentially as a response to this wound healing signal from the platelet-rich plasma. This has been shown objectively in research where wound healing was performed for exposed bone with platelet-rich plasma alone and hyaluronic acid alone, and then in combination. So a similar type of thing is happening with how we use it in aesthetics, and we use it a lot. This combination is the basis for the very popular vampire facelift, which we perform. So I would say that it is very important that you understand these options and understand that it isn't a definitive treatment, that you will need to do some maintenance. So I hope that was helpful. I wish you the best of luck, and thank you for your question.